Welcome back, everybody. Welcome to round 5 of the Hot Wings Challenge. So I guess we are going to really start getting into some of the spicy wings. At least I am. Oh my God, this hot sauce is getting redder and redder, which means more and more trouble. But I would like to welcome our new guests. This is Dr. Josephine Del Greco, otherwise truly the Italian way is Giuseppina Del Greco.
Giuseppina Del Greco.
Yes, exactly. And this is Carrie Ann Brady. Carrie Ann Brady is the Director of Education for the Pediatric Emergency Medicine and is essentially the head of everything educational for pediatrics. And this is Dr. Del Greco, who's one of our pediatric emergency medicine faculty here, who's also one of the pioneers of the patient experience. So why don't we start with Dr. Del Greco?
Okay.
So tell us a little bit more about the clinical experience for residents in terms of pediatric emergency medicine.
Sure. So we have residents in our emergency room all 3 years. It's a longitudinal experience. So they're rotating all year long. So there's no month to month. That way they see things all year round. So they won't miss bronchiolitis season. They won't miss flu season. They don't happen at the same time. During the summer, we tend to see a lot more, broken bones. So that way, when we have everybody rotating throughout the entire year, they'll experience a little bit of each. And they're in the ER all 3 years, I should say. So at least in that way, from beginning to end of their residency, they will always feel comfortable with pediatrics.
That's really good because I remember when I trained, I was stuck in the PICU in July.
And you see nothing.
I saw no respiratory illness. So there is that seasonal variability
Yes.
of illness that you miss out when you have dedicated Peds month. So I'm glad that it's a longitudinal experience.
Most definitely.
What percentage of EM shifts would you say by the end of their graduation, by the end of their training, is in the Peds ED?
About 15 to 20%.
Oh, okay.
So it's the ACGME accredited amount that they should be in, but it roughly comes out to 15 to 20%.
Okay, that's great. And you have I'm assuming that you have a dedicated Peds ED.
Yes. So
Okay.
it's about 17 beds. One bed is fully dedicated to resuscitation. We also have, oh sugar, I forgot what I was going to say. Sorry. Is it
It's okay.
Just keep going?
It's okay.
I was just like, wait a minute, 17 beds. Oh, an isolation
And if
room.
if it's not okay for this, it's okay for the blooper reel. Don't worry.
Okay. We also have a dedicated isolation room as well. So during COVID season now, we've been utilizing that as well.
Okay.
We see our sexual assault patients in that room as well. So we have a dedicated GYN room, GYN bed, I should say. So it's good. 17 beds. We have 7 full pediatric ER trained attendings. Okay. So it's not just the pediatrician who doesn't really have experience with emergency medicine. Everyone's done fellowship. So everybody's very comfortable with seeing pediatric patients in an emergency room setting.
So are the majority of your PEM attendings primarily pediatric trained with emergency medicine fellowship,
Yes.
or EM trained with pediatric emergency medicine fellowship?
For the most part, unless someone's different, we are all pediatric residents that trained with an emergency medicine fellowship.
Gotcha. I think there's maybe
We do
one
have
exception.
one,
I think
and
that's
she's super special because not only is she EM and then Peds EM, but she did a Peds ED ultrasound fellowship as well.
Oh yes, Dr. Park.
Hannah
Yes.
Park.
Dr. Park
Yes.
does it all.
Yes.
She's adult, she's peds, she's
Trifecta.
ultrasound. Yes, and she's a mother of 2. So
Yes.
that's probably the most important accomplishment.
Yes.
Okay, great. Well, thank you for sharing all that. Let's switch to the educational component. Let's just talk about the pediatric didactic experience in terms of conference
Right.
and critical care.
Well, every Wednesday is a conference day, and approximately every 6 weeks we'll have it's called a Peds Day, and either doing through foundations or through small groups, we will cover pediatric topics, and it can include things like radiology, EKGs, core lectures, and then something that always happens is a simulation case. And we're very big on pediatric simulation, and even not on specific PEDS day, there will oftentimes be pediatric cases that we cover. And then we continue to use that in our critical care educational part as well, that we have our residents rotate through the neonatal ICU and our pediatric intermediate care unit, and there is a simulation component to that as well.
And I hear recently you were about to start lectures with Cornell as well in terms
exactly.
of the pediatric critical
so that
care.
we'll be able to listen in on their critical care attendings and guests speaking on pediatric critical care topics.
Well, I know for a fact from the residents that when pediatric critical patients do arrive and procedures do present themselves, they all feel very comfortable doing those procedures and taking care of kids. And, you know, being a PD, I know that after they graduate and they go on, they call me back and they say, I feel comfortable literally with everything, including sick kids, because I think that's always a fear for emergency medicine residents is, will I be able to take care of sick kids? Because let's face it, sick kids, all, like, you know, they scare all of us.
Yes.
The blue baby is the blue baby, right?
Yes.
So thank you. And then is there also a pediatric track for residents who are interested in pediatric, in PEM?
Yeah, I'm the leader of that, and we meet every month or every other month, depending on the holidays and that kind of stuff. But kind of working on actually. Right now, I was just meeting with the residents that's involved about furthering simulation and maybe coming up with some protocols for helping just to being able to have the adult people feel more comfortable with pediatric stuff like, status epilepticus and what to do in asthma and that kind of stuff, just to make it more routine. Because I know so much of adult emergency medicine is going through scores and pathways and that kind of stuff, and it just makes it easier to recall when you do take care of those sick blue babies and that kind of stuff. So.
Yes. I think especially after, we've been hit with the COVID pandemic, I think a lot of the adult attendings have become a lot more comfortable with pediatric care as well. So now let's talk about fun stuff. Like the PCD is it's fun. It's colorful. You walk in. It's like there's got this marine environment, aquamarine, kind of motif.
Yes.
You guys are the only cool ones that really dress up on Halloween.
Yes.
I see some pictures up here right now of Halloween in the PZD. Tell me about that.
So we are the only ones that have a nice ambiance in our emergency room. I think it was about 4 or 5 years ago that we got a grant and we had an artist come in and we went with a underwater theme. So each room has a dedicated fish. So we have like the whale room or I think there's like seals,
turtles and
turtles,
whales, that kind of stuff. Yeah.
So it's nice. It's fun for the kids.
The octopus is kind of scary. I'll be very honest.
There's
For a
like
pediatric ED,
There's a
it's
little
got like the
pirate ship in the
tentacles
back, so it's got a little treasure chest, so it ties in very nicely.
Right, when my daughter was there, she was like, "That's scary."
And then every year we decide to do a dress up for Halloween. So we'll do a group contest where at least that way we can all have a little partake in the Halloween season. And I want to say 2 years in a row.
Yes.
We won for the best group contest.
Mm-hmm.
Everyone gets
for the whole
involved.
hospital.
Yes. The residents. We have the nurses as well. Even our ED chairman, Dr. Sharma, got involved, and he was Iron Man one year, and we won for superheroes. So it's fun. It's a lot of fun.
He's a different superhero every single year.
Yes, he is.
I'm sorry. I'm speaking while talking, speaking while eating, but. Well, thank you so much, both of you, for joining us.
Thank you. Thank you for having us.
It was a pleasure, and I'll let you get back to your shift.
Thank you.
And thank you for joining us.
Yeah, great. Thanks for having us.
Okay, that's round 5, guys.